So my name is Anthony Marois. I'm an orthopedic sports medicine surgeon here at Emerge Ortho. I'm originally from upstate New York. I came to North Carolina for undergrad, which I did at Wake Forest University. And then I stayed there for medical school, got my MD degree at Wake Forest School of Medicine. Then I did my residency training out in Memphis, Tennessee at Campbell Clinic, where I had the opportunity to work with some really world-renowned faculty and work at one of the busiest level 1 trauma centers in the country. And then I spent 1 extra year doing additional specialty training at Mississippi Sports Medicine in Jackson, Mississippi, where I really got to hone my skills specifically in the field of sports medicine. Sports medicine is really a unique field. We don't treat necessarily one joint or one body part, but we really use a set of principles and techniques really centered on minimally invasiveness, where we can use small incisions and cameras to do surgeries that otherwise used to take really big incisions. I've been an athlete my whole life. Being active and helping people stay active has always been a passion of mine. And I really enjoy that I get to work with people that really are looking forward to getting better. I think it's a really unique and fun field. In sports medicine, I treat a variety of injuries. So again, I don't really focus on just one joint or body part. I focus on a broad set of injuries, mainly in active people. Sports medicine for me ends up being shoulders and knees with some element of hip and elbow. So in the shoulder, the most common things that I would treat would be rotator cuff tears, shoulder dislocations, shoulder replacements. In the knee, the most common things that I would see would be ACL tears, meniscus tears, or kneecap instability. I actually also do hip arthroscopy in the hip, which is a minimally invasive approach to hip impingement. And in the elbow, I would do things like tennis elbow surgery or even Tommy John surgery. My patient care philosophy is that every injury in every patient is different and requires a different approach. So I always ask my patients about what kind of work they do, what kind of hobbies they have, what kind of trips or life events they have coming up, because I really like to tailor my treatment to every patient and their life circumstances. So a meniscus tear in one person might be treated non-operatively, whereas in a different patient, something like a meniscus tear might need surgery for a repair. Yeah, so just because I'm an orthopedic surgeon doesn't necessarily mean that surgery is going to be the right option for you. So I have several different non-operative treatments that we use all the time, things like anti-inflammatory medications, physical therapy, injections, whether it be steroids, gel injections, or PRP. We have a lot of options before we get to surgery, certainly. So outside of work, I'm still really passionate about running. I was a college runner. I enjoy staying fit, staying active. Another thing I enjoy is golfing. I get out there as often as I can. And then we like to attend sporting events, whether it be high school, college, professional. We go to all of them. You don't have to go out of town to get expert care. You can stay local and still see fellowship-trained orthopedic surgeons right here in Sherrills Ford or the Newton offices.